Good afternoon. Thank you for joining us here on Friday afternoon for an update and some very important news and some exciting news for our small business owners across Mississippi. Before we get to that, though, I do want to begin by continuing to recognize that we are seeing more and more cases across the state, and it is a reminder that this is not over. A flat curve does not mean a community free of transmission. It means we are spreading it out over time. The risk is still very, very real. Even as businesses reopen and people begin to reconnect, we must stay smart. We must stay sharp. Take care of yourselves and take care of your loved ones. Open for business does not mean risk-free. We all need an extra measure of personal responsibility as we move into the summer months. Today, I am extending the executive order that puts stricter health rules in place for certain counties with the greatest risk. It will be in full force and effect at least until June the 8th. We will be amending it. We are going to add Wayne County, which, as we discussed yesterday, is one of the most dangerous parts of the state when it comes to COVID-19 transmission at this moment. If you live in Wayne County, please take greater risk measures to protect your family. It's the reason that Dr. Dobbs was there yesterday talking with those in the community. You are at severe risk of spreading the virus. In addition to that, we will be removing Atala County, Leake County, Scott County, and Newton County. Dr. Dobbs has advised us that many of the measures that we put in place are working in those counties. This is illustrative of our plan. When those counties increase in cases, we want to add restrictive measures. As those restrictive measures work, we want to remove them so that we recognize that this is a fight county by county, not statewide, and therefore the increases in cases are county by county more so than statewide. What happens, for instance, in Wayne County has very little effect of what's going on in Tishomingo County, and we as a state must understand that. Dr. Byers will speak to it in more detail, but these communities have done an excellent job stepping up. They are fighting and they are beating the virus. This order will be extended, however, for Holmes, Jasper, Neshoba, and Lauderdale County as well. So we had 8. Initially we had 7. We added 1 and went to 8. We are reducing 4 and adding 1 back, so we're back to 5 in total. In addition to fighting this virus, we are also working to quickly get out funds from the CARES Act to our small businesses. We are launching a website today, backtobusinessms.org, which outlines eligibility requirements and paperwork to compile to get access to this grant program. You can see the backtobusinessms.org front screen behind me. That is critically important for our small business owners. Small businesses with less than 50 employees can get up to $25,000 to help offset the cost to their business caused by this pandemic. It has frequently asked questions and information that you might need to ensure that when there is an application to apply, that you're prepared to do so immediately. The team at the Mississippi Development Authority is reviewing the competitive bids to administer these funds. They were due today and should have all the details out by the evening. Then they can put out the application as soon as next week if all goes according to plan. I just want to close by reminding my fellow Mississippians, this deadly disease is real. This deadly disease is contagious, and this deadly disease is in every community across our state. We must stay vigilant. More freedom does not mean less risk, just the opposite. It means that we are trusting you, the people of Mississippi, to do what is right. It means we respect you enough to make your own decisions. But I'm asking you, as a fellow Mississippian, to be wise. Please continue to stay strong. Please continue to stay in the fight. Please continue to be safe. At this time, I will turn it over to Dr. Byers, who will update us from a public health perspective. And as you can see today, I have with me the A-team.
Thank you, Governor. So today we're reporting out 418 new cases. Those are newly reported cases to the Department of Health, and 17 new deaths. 4 of those deaths are from our death certificate reviews that we do, and those deaths occurred earlier in the month between May 11th and May 15th, but it's still evident that we are seeing cases in Mississippi, and we are seeing deaths that are occurring. We are still having ongoing outbreaks in many long-term care settings throughout the state. This is particularly worrisome because we continue to see a higher proportion of deaths among long-term care residents. We're looking at about 50% of our total deaths in the state are among residents who are in long-term care settings. We know that those types of settings are very vulnerable. When you have any congregate setting, especially with individuals who are at significantly higher risk for those complications and deaths, we do see that, and we may well continue to see that. One of the efforts that we've put into place is testing of all long-term care residents and all long-term care employees. That's been ongoing now for a short time, and we've completed more than 80% of those long-term care settings, with just a few more to go in the coming few days. So that's a big win for us. That helps us establish a baseline of current spread within a long-term care setting, and helps us move forward with additional measures that we can put in place. The governor did mention that we've seen some decreases in those 4 counties, and that they're coming off the list of higher recommendations. I think it's been pretty astounding when you look at the data that those 4 counties have had some drops in their cases, not just stability, but actual decreases in the numbers. I think that that's evidence of how these measures can work. If we're all continue to do those things, wearing a mask, social distancing, those are measures that can be effective in preventing further community transmission. And when you have community transmission, there's always a risk that you'll introduce it into long-term care settings. That's an effective way to prevent that as well. You know, one of the things that we're doing is watching individual counties closely. We know that often the increases in particular counties are due to increased testing. Right now in Mississippi, we've tested more than 160, or close to 160,000 tests total in the state. When you look at our goal of 2% of the population, we're reaching that in the last 4 weeks. In the last 4 weeks, we've averaged somewhere between 17,000 to 20,000 tests occurring in Mississippi. That's an astounding number. And what that shows you is that through our partnerships with hospitals, with commercial labs, and the broader availability of testing throughout the state, that there is testing available. But we do know that when we do additional testing in counties, we often see some increased numbers of cases. So that's an illustration that any of the counties can be particular risk. And so even if you're not a county that's identified as in these higher measures through the governor, it's still important to take those standard precautions that we've talked about across the board for everybody, and that's how we can prevent those counties from bumping up higher. Thank you, Governor.
Thank you. At this time, I will turn it over to Mac, who will give us an update and some really, really important and very good news from our federal partners. Mac?
Yes, sir. Thank you, Governor. Seems like every Friday I come in with a new bit of news. FEMA just gave us a notice that our storms that happened back in Easter, we have 26 counties that have been added to public assistance, and those came out today. The counties of Bolivar, Calhoun, Carroll, Chickasaw, Choctaw, Clay, Coahoma, Holmes, Lafayette, Leake, Montgomery, Noxubee, Quitman, Smith, Sunflower, Tallahatchie, Tate, Tunica, Webster, and Yalobusha. We also had 6 counties that already had individual assistance. They were added for public assistance as well, and that is Clark, Grenada, Jasper, Lawrence, Panola, and Walthall. And what that does, that opens up all the categories of work, whether it be debris removal, whether it be reimbursements for Cat B emergency services that they had to do during the flooding of the Pearl River, as well as other categories as well, parks and other governmental buildings, any damage that was done. We also got today, Governor, that our disaster 4538 that occurred, we have Wilkinson County that got added to public assistance. So that brings that number up considerably, including the disaster was 11. So we've added Wilkinson. We can safely say today that we have done preliminary damage assessments in Nissaquina County, and the water has receded just enough that we are now in Sharkey County, and we're trying to complete those preliminary damage assessments in Sharkey, and that will get those 2 disasters taken care of. When we talk about the Easter storms, I do want to talk about, there's been over 2,500 registrations in individual assistance. That's anywhere from homeowners, renters, and people that need assistance. So about 3.9 million has been approved in that program, 382,000 yesterday. So we continue to do the home inspections and get those things turned on. In direct housing assistance, 3.2 million was part of that, and in the other needs assistance there, it was 715,000. Also, with any disaster that we have on the federal side, the Small Business Administration comes to town. So we're looking at, out of 224 received applications, 84 of them have already been approved, and that means those folks can refinance, and we've got $5.7 million refinanced at that disaster loan rate, which is considerably lower to help them in their time of assistance. We had requests for 1,357 home inspections. I'm proud to say that SBA and all that they bring to the disaster response, 1,287 have been done, and that's 94% complete. So we continue to work out on the field and make those things happen. On our logistics side of the operation for COVID, we received in the warehouse just yesterday. We continue to purchase supplies because I'm planning 45 days out, almost 60, because that's what it takes to get some of these supplies in the smaller amounts that we're able to get them. So 867,000 masks came in today, 117,000 face shields, 503,000 gloves, 100 more thermometers, and 5,000 gowns came in just yesterday. So we're receiving some of that today. So when we look at deliveries, you know, we've told y'all many times that we deliver. I'm not like the Postal Service. I deliver Monday through Friday, but we do hot shots on Saturdays. So that's not our regular routes. So just yesterday, 3,474 miles were put on trucks in the state delivery, and that's considerable. So our total amount is 113,000 miles traveled in delivery trucks all over the state, whether it be counties, hospitals, long-term care facilities, those that need those supplies, and just-in-time logistics. I am proud to say that when we did the community mask shipments the other day, along with Dr. Byers, Dr. Dobbs, and we had a hot spot in Wayne County yesterday, we delivered over 21,400 masks. Total population, the last census was about 20,700. So through our last push that we had just last week, and this one, we're attacking those hot spots as quick as they can be identified. And it's worked. We've been able to knock things back down, and I want to thank the public for getting those, and also those EMA directors and the volunteers that are actually distributing those masks, because that is a chore within itself. I get to pass off a big bundle, and the local EMA directors, they have the task of trying to get those out through faith-based groups and other volunteer organizations. They're doing a fabulous job at that, sir. Absolutely wonderful. Total distributions today on medical grade things, disinfectant, about 168 gallons of disinfectant, and wipes, about 35 cases of wipes went out, medical grade, 21,000 gloves, 4,900 gowns, over 10,000 masks, medical grade went out. And we also were able to deliver on the non-medical grade side, 10,000 face shields, about 58,000 gloves, 14,000 gallons, hand sanitizer, 1,300, and that's either gallons, quarts, or paints. We'll bring you whatever size that you need. And I do want to say thanks to Chevron when they donated 330-gallon transport vehicles to us full of disinfectant. We've actually been able to convert that over into smaller sizes and get them out, and 25,000 masks. So it's been busy at MEMA, but it's what we do. We've got a smile on our face today because we're helping get the survivors back to where they need to be. And sir, that's all I have.
Thank you, Mac. And I want to thank you and your team at MEMA. And you said something earlier that I think is critically important, and I want to personally thank all of the emergency management directors in all 82 counties that work with the Mississippi Emergency Management Agency. They don't necessarily work for, they work for their local counties and their supervisors, but our partnership has never been stronger. They have never worked harder because this has been the distribution of these resources, masks and face shields and gowns, has been difficult. And now as we've made that next step where we've delivered 2.25 million community masks, those aren't being distributed to one facility or to one hospital. They're being distributed to everyone in our state. It is quite amazing that in a state of 3 million that we've already been able to distribute 2.25 million masks so that everyone, regardless of their income level, has the ability to get a mask if they need one and want one, and we recommend that they do. I just think that says wonderful things about our local emergency management officials, and I want to personally thank you on behalf of all of our citizens because you are truly doing the Lord's work, and I appreciate it very, very much. Now, this PPE that we are acquiring and distributing to our people is critical. It is imperative that we continue to do so, and because of that, and by the way, it is not cheap, it is expensive, and that is the very reason that the CARES Act was passed by the United States Congress. And so we will expect that the Mississippi Legislature will appropriate significant amounts of money for the PPE that has already been purchased as well as PPE that is yet to be purchased, because when we talk to Dr. Dobbs and Dr. Byers, we have to be prepared for another outbreak in the fall. We hope it doesn't happen, but we think it's very likely, and we must be prepared to do so. And the numbers are staggering. It's tens of millions of dollars, perhaps even $100 million, and hundreds of millions of dollars that we're going to be spending from our emergency management agency. But that is the very reason that the Congress gave the states significant resources to deal with it, and we fully expect and anticipate the legislature will be on board with appropriating significant resources for that purpose. In addition to that, when we look at our unemployment trust fund, that is another area where, were it not for the coronavirus, our financial position would be far better. Let me just give you an example. The week of March 23rd through March 27th, wasn't that long ago. It feels like it was 150 years ago for some of us, but that was just a couple months ago. The week of March 23rd through March 27th, the state of Mississippi spent $1,330,000 on unemployment compensation. Since that time, we've spent $1,160 million. Just May 26th through May 28th, we spent $188,351,829. Now, much of that money is federal money that's already been paid for through the CARES Act. But that which was state money is going to end up being probably at least a $300 million expense. We fully expect and anticipate the legislature will support our efforts to refund the unemployment trust fund that $300 million. The reason that is so critically important is because it is small businesses that actually fund the trust fund. If the legislature chose not to refund the trust fund, then you would see tax increases on small businesses. This is the absolute worst time that we would put tax increases. I'm always against new taxes, but surely everyone will agree that this is the worst time, with business being down, with expenses being up from COVID-19, to raise expenses further by allowing taxes to be raised on our small business owners. And so that'll be another ask that we work with our friendly legislators on in the coming days and weeks. In addition to that, before I leave unemployment insurance, I do want to mention one more time that we absolutely are going to take unemployment fraud seriously. We are hearing reports from around the country that there have been fraudulent claims on the unemployment trust funds throughout various states. Many of these are done by hackers and other online activists. We are going to be very serious about that. If you file a false claim, we are going to find out, and we will prosecute. It slows down the process for everyone else when we have to deal with those. Do not file unless you are entitled to the benefits. If you are unsure if you qualify, just tell the truth about what's going on, and our people will work with you to make sure that every single person that is entitled to benefits will receive those benefits. I am committed to it, our people are committed to it, and I know the people of Mississippi are committed to it. With that, I'll open the floor to questions. Courtney?
I know a lot of us just left over at the Capitol. Just your thoughts on, although it was peaceful, the protest happening today downtown regarding what was happening in Minneapolis. They were standing united with those individuals who were speaking out against police brutality.
Well, I will say to you the same thing I said several weeks ago when there were those who were rallying against openings and closings. I fully support everyone's individual right to protest their government, to protest government decisions, as long as they do so in a peaceful manner. That is a constitutional right that is one of the very foundations of our country. I would just ask them and anyone who continues to protest today or tomorrow or any other day to do it responsibly, wear a mask, stay 6 feet apart, and do it in a way that is not over the line. We have seen some protests in other parts of the country where they have taken rocks and thrown them through police car windows. That moves beyond that constitutional right, and that is not acceptable. But we did not see that, to my knowledge, anywhere in Mississippi, and so again, I just encourage those who do participate to do so in a peaceful way, and I will always and forever defend individuals' right to do so. Renee.
Paul Keene with the Wayne County News has a question.
Yes, Governor, can you kind of recap or go over the additional restrictions that Wayne County will be under since they've been placed under that executive order that the other counties were under?
Yeah, Paul, thank you very much. I appreciate the question. I hope you're doing well. There's a number of things that we are asking in Wayne County. The number one thing is that everyone, and you will play a significant role in this because you do such a great job getting the information out to the people in your county. But the number one thing that I can say is please be aware that we have seen a large number of cases in Wayne County, and that's the reason we've added the additional restrictions. One of the things that we have done in other counties and can continue to do in Wayne is we have sent additional community masks, and we are encouraging, if not requiring, everyone that goes out in public that they wear a mask. We think that's critically important. We've also had additional We've also placed additional restrictions on things such as public gatherings for social purposes. We've reduced the numbers there compared to other counties. And so I'll be sure and get you a full list of all of the additional measures that are in place. And I don't know, Dr. Byers, if you want to speak to that as well.
Yes, sir. Thank you. No, that's a great question. And when we look at Wayne County in particular, one of the things that we've seen with the community transmission there is it looks to be tied to larger gatherings where individuals are not utilizing masks, where individuals are not utilizing social distancing, where they're congregating in large groups. And we know that that is a way that we can start seeing cases and transmission. So, you know, the basic principles that we're asking folks to really adhere to in Wayne County is utilization of masks when you're out in public, social distancing, avoid those large gatherings. If we take that personal responsibility on ourselves to do these measures, that's how we can, and it's been shown in other counties, to diminish the transmission that's being seen there.
Taylor Vance with Daily Journal has a question.
Thank you, Renee. I have a question for Governor Reeves. Governor, I just wanted to ask you about the census. Obviously, with the pandemic ongoing, there are some concerns that the response rate may not be as high as it typically would be. So do you share any of those same concerns, and do you have an update on what the state is doing to maybe counteract some of this and to have a better response rate so that the state could receive more funds as possible?
Well, thank you, Taylor, for that question, and you're exactly right. We have numerous times over the last several months encouraged individuals to participate in the census. We have expended resources to advertise for the census. There is no doubt. And by the way, while our numbers are not where they need to be on a relative basis, we're actually doing better than most states in terms of the responses at this time, because unlike many disasters, Mississippi is one of all 50 states that is, and 54 states and territories that are dealing with this particular pandemic during the middle of the census. That's the reason it has been delayed. But we need to do everything in our power to encourage our fellow Mississippians to participate in the census, because there's no doubt that long-term federal funds associated with specific programs are dependent upon the number of people, not that live in your state, but the number of people that are counted during the census. And so I strongly encourage our fellow Mississippians to please go online to take the necessary steps to participate, because that's critically important to Mississippi long term.
Erica Hensley with Mississippi Today has a question. Erica?
Thanks, Renee. This is a question for Dr. Byers. I'm wondering if the confirmed cases total that we see derives from all positive tests or just positive individuals. I've been a little confused by that since the test reporting switched from individuals tested to total tests administered a few weeks back. So I'm basically wondering if the people who test positive twice, like, you know, in long-term care settings right now when we're retesting, if they show up in the confirmed case total twice.
Gosh, that's a great question, because it can get confusing, because a lot of people will have multiple tests, not just a test with a PCR to detect the presence of the virus, but also through other methodologies like serology. And so one individual who's identified as a case only counts once in our total. Whether or not they have multiple tests, either negative or positive, they count as one case. So what we do when we receive a report of a positive test is we investigate that. We determine whether or not that individual, first of all, you always confirm the diagnosis. Did that positive test go with that person? Was that person symptomatic? And then we do our case and contact investigation. It's a bit easier around those methodologies to detect the actual presence of virus, because if it's there, that individual is infected and counts as a case. Serology requires us to do a bit more of an investigation to determine if that person truly is a new case.
Thank you, Erica, for that question.
Dave Ellett with WOX has a question.
Good afternoon, Governor. A question for you regarding public schools, K through 12, moving forward with returning this fall. A USA Today poll, again, this was a national poll, showed that 1 in 5 teachers say they are unlikely to return to the classrooms if they're reopened. Teachers, parents, students, a lot of them are concerned. And the poll also found that 83% of teachers are having a hard time doing their job with distance or remote learning. Do numbers like that and concerns like that raise any red flags for you?
Well, thank you, Dave, for the question. As I have said many times over the past several months, every single one of these issues raises concerns for me. There's no doubt about that. The fact is that these are times the likes of which we haven't seen in this country in over 100 years. And so I know that there are a lot of people out there, teachers and otherwise, that are concerned, they're scared. We've got a lot of parents who are concerned and they're scared. And that's the reason that we have got to be smart. We have got to find the most safe way that we can get our schools back open, because we don't believe that it is an option that we're going to just allow our kids to be out of school for a year or a year and a half until a vaccine is found. And so we're working with the health department, we're working with the Department of Education, we're working with the Board of Education to find the most safe way for our individuals to go back, for our young people to go back to school. And we certainly need to work with our teachers to do everything we can to make sure that they are comfortable in the classroom. Now, the number that you mentioned with respect to some 4 out of 5 teachers are finding it difficult to do distance learning, that doesn't surprise me at all, because we're asking them to do something that we've never really done before. And in some instances, we have adequate resources to do it. In many instances, they do not have adequate resources to do it. And so, yes, it's been very difficult. And it's one of the reasons that I believe we have to get back in school, because I am concerned that the multiple months of school being closed most likely widened the gap between those who were being successful and those who were not. And that's something that I am very concerned about. It's something that I have personally worked on for the last 8 years, is slowing down that gap, reducing the size of that gap. And most people don't understand this, but Mississippians and Mississippi actually has done a very good job of that for many, many years. It's one of the reasons that our 4th grade reading and 4th grade math testing, our 8th grade reading and our 8th grade math testing results have been so positive and so favorable over the last 10 years. And it's because our achievement amongst various classes and various races, our achievement gap is actually very, very small relative to virtually every other state.
Taylor with Daily Journal has another question. Taylor?
Yes, I have another question for Governor Reeves, and this is a 2-part question. First part is there were some concerns early with legislators that MDA may not be able to efficiently administer this program, and I was just wondering if you could maybe provide an update on what is being done, or what MDA has done to make sure that a repeat of what initially happened with the Department of Employment Security, as far as them getting overwhelmed initially, just to make sure that that may not happen when these applications are submitted to the website. And there was a sum of money that was appropriated for MDA to administer these funds. I was just wondering if you could provide maybe an update on what some thoughts on how to administer, on how to use those funds are. And second part of the question is yourself, the Speaker, the House, and the Lieutenant Governor have said that these funds cannot be used to make up for lost revenue. They can only be used for extra expenses that have been incurred. And so are there any thoughts right now being considered for how the state can actually monitor that these funds are going to be spent the way that each of you believe that they should be spent. I mean, is there any thoughts about requiring businesses to, provide proof that this is what they're being, that they're spending the money correctly, or, audit them, or anything like that?
Right. Thank you very much for that question. And that has been the point of contention and point of argument from day one regarding this is, and it's not that I have said that we have to make sure these businesses prove it. It's that the United States Congress and the United States Department of Treasury have said. After all, these are federal dollars that were appropriated by the Congress for a specific purpose, and Treasury, through their guidelines, has said this cannot be utilized for revenue losses. It has to be utilized for the purpose of offsetting expenses that were caused by COVID-19. And so, yes, we very much are aware of that. It is the reason that you have seen us fight for ensuring that we have an administrator, a third-party administrator in place to administer these funds so that they can basically do an audit on the front end, so that we have an application that ensures that the state is protected under the guidelines that the Treasury Department has put forth, as well as under the guidelines in any state legislation. And hopefully we'll be naming that third-party administrator at some point in the very near future. And it's the third-party administrator, along with the Mississippi Development Authority, will ensure that we conduct and enact that in such a way whereby that is the case. When I think about what MDA has done, I think if you will go on this website, which as a reminder is backtobusinessms.org, there is frequently asked questions. The actual application is not on the site yet. It should be sometime next week once we get the third-party administrator confirmed. And that's a process that the Mississippi Development Authority and the Department of Finance Administration are going through, and they've expedited it, and they're working very hard. They're complying with state statute. Once we get that done, they will verify that the application meets the threshold and the guidelines set forth by Treasury, and then it will be allowable for people to comply. We know that there's going to be initially a rush in terms of the total number of applications. That's what happens when you go from 0 to literally 300,000 in the case of unemployment, and that's what's going to happen here. We have done everything we can to make sure that we are prepared. There are going to be growing pains. We are starting up a program from scratch that has never been done before. We know that there are going to be challenges in the early days, and what I would say to you is the same thing I said to my fellow Mississippians in the late March, early April time period of the unemployment insurance crisis. Bear with us. We are scaling up. We are doing everything we can. And literally since that time, we have distributed $1.16 billion to our fellow Mississippians. And that is in a period of basically 8 weeks. And as a reminder, the week before that, we distributed $1.33 billion. And so we're literally about 200 times more in total number of dollars going out on a weekly basis than we were just 8 weeks ago. We've been able to scale that up, and we're continuing to work, and we'll do the same thing with the Mississippi Development Authority. Great question. Yes, sir.
Why do you need a third-party administrator? Is there not enough lawyers in Mississippi state government who could interpret it correctly, or employees?
There are not adequate employees to distribute tens of thousands of checks in a very short period of time. If we had a bunch of employees sitting around doing nothing, then the taxpayers would be screaming bloody murder, as well they should. We have actually reduced the total number of employment in state government by 6,000 employees over the last 8 years. That's a figure that I'm proud of. We have right-sized government, but because of that, when we have a new program that is funded by the federal government that is requiring tens of thousands of checks and hundreds and hundreds and hundreds of millions of dollars to be distributed, to do it in a very quick way, we've got to scale up very quickly. And no, we don't have enough lawyers in state government, and no, we don't have enough employees in state government sitting around that can just flip that switch.
It seems like more and more frequently we're getting questions in your office maybe as well about the latest update with the DMV or driver services. What is the latest? When should people anticipate hearing something? I know that it's probably a complex process in terms of the safety measures that go behind it, just as with many of the industries, but
Very, very, very soon. We are actually, we have our new Commissioner of Public Safety, which will be starting on Monday. What that means, by the way, is he's only been working 12 hours a day for the last 5 or 6 or 7 days since he's been announced, and he'll start working 24 hours a day on Monday. But in all seriousness, he and I have been having conversations about that, as well as some of the ongoing things that are happening in our state right now. But I would anticipate that very early next week we will lay out a detailed plan of how we can get DMV back open, to do it in a safe, responsible way. But also, we're talking, and here's what's important. We've got to scale up there as well. We got to scale up the number of folks that are working there. We got to make sure that we understand that there is going to be a backlog. There was a backlog before we shut it down for a number of months, and so it's going to be even worse. But we can fix it. We are going to fix it. We are committed to fixing it, and I'm confident that we will get it fixed. But it is going to take a little time. But in terms of announcing the time frame, early next week there will be an announcement.
Erica with Mississippi Today has another question. Erica?
Thanks, Renee. Earlier this week, Dr. Dobbs talked about the limited remdesivir treatments that went out to some hospitals, and he might be the best to speak to this. But can y'all tell us which hospitals or what parts of the state received those meds, and what was the decision process for where the limited doses went?
And I thought you were going to ask me my medical opinion as to the best way in which to treat patients, but I guess I'll turn it over to Dr. Byers instead.
Yeah, and I don't have that data right in front of me, and we can certainly look at that. But the decision process, and we have had, limited doses issued to the Department of Health for distribution in hospitals, and the goal of that is to deliver that to hospitals where we're seeing patients that would benefit most, and that's individuals who are on oxygen, some people who are on ventilators, and so we're looking for those hospitals that have the highest numbers consistently of those individuals who are most seriously ill. And so we've received some additional allotment, and we are now working on a process to provide that to a wider group of hospitals for them to be able to directly request the distribution of that medication to their hospital for utilization in their patients. And, it's still a limited supply. We're going to spread it out as best we can based on those individual patients that need it the most. And so stay tuned, but we're going to be working on a process for hospitals to be able to request that from the public health pharmacy directly for distribution to those hospitals.
The only thing I would add is my recollection, and this is from several weeks ago in our conversations with the Coronavirus Task Force, is that Gilead is the maker of this particular drug. They had donated 600,000 doses of this particular medicine to the federal government. The federal government distributed it to the states, and then we distributed it through the state health department down to our hospitals. It's much the same way in that we didn't have additional state employees sitting around ready to distribute tens of thousands of additional checks. I don't think that Gilead had in their production hundreds of thousands of extra doses of this medicine, and so the process is taking time for them to get it ready and ship it out, and we're getting a little bit more each week or every other week. Yes, ma'am.
can either of you speak to Issaquah County? It's the anomaly, it seems. I know you mentioned that there's still been flooding up until recently. Do we think that it is just truly that they are by nature social distancing, or what do we think's happening?
We see variations in the number of cases throughout, and you're right. We haven't identified any cases in Issaquah. It's a very low population county, and if you look at other diseases, we see low incidence of a number of infectious diseases in Issaquah County. Remember that testing identifies cases. The cases that we report out, that we've identified from the Department of Health, don't represent every single case that has occurred in Mississippi. Those are the cases that either asymptomatic or not having any symptoms who got tested, or those individuals who were sick enough to present to their physician or at one of the testing clinics to be tested. We know that there are individuals who may be infected who show limited symptoms or no symptoms. So when you look at any county, our expectation is that we're seeing community transmission in pretty much all areas to some extent throughout the state. It would be surprising if we were able to say that there are absolutely no cases in Issaquah County. They just haven't had any positives yet. But that's a great question. Thank you.
Yeah, I think it's obviously it's a rural county, but to be fair, Mississippi right now it has seen less than 0.5% of our population test positive. There are only 1,308 people in Issaquah County, and so 0.5%. So even if they had their fair share, if you would, in the state, they'd have 6 cases, and so it's just the combination of those things. And the reality is, as Dr. Byer said, they've probably had a case or two that were asymptomatic and just weren't tested, and because we see that's true in every community as well. Any other questions? Seeing none, happy Friday to everyone. I know that y'all have been diligent in your efforts to help slow the spread of this virus. I want to commend all of my fellow Mississippians. This is a weekend, and it is not a weekend to go out and party hard and get up in gatherings of hundreds and thousands of people. Be smart, stay safe, and God bless.